Many high-functioning autistic, ADHD, and other neurodivergent people turn to alcohol or drugs, not because of moral failings, but to quiet chronic overwhelm. This video explains why that happens and how to talk about it compassionately. Intense sensory input, bright lights, loud spaces, crowded environments can keep the nervous system on high alert. For some neurodivergent people, substances reduce the intensity of that input, offering temporary relief from constant tension. Masking, forcing oneself to mimic neurotypical behavior, requires non-stop effort. Over months and years, this leads to deep exhaustion and burnout. Substances can become a way to finally relax or sleep when other options feel out of reach. ADHD and autism often involve differences in regulating emotions, controlling impulses, and planning. Substances can appear to be a quick fix for sudden emotional surges or to bypass task-related anxiety. Anxiety, depression, and trauma commonly co-occur with neurodivergence and are often underdiagnosed or mistreated. When symptoms go unaddressed, some people self-medicate to manage distress in the short term. Exclusion, misunderstanding, and few accessible resources can leave people isolated. When formal support isn't available or welcoming, informal coping like substance use can feel like the only tool that helps. Stigma about both neurodivergence and substance use discourages open conversation. Shame makes people hide their coping, which prevents getting safer, more effective help. While substances can feel helpful short-term, they carry physical and mental health risks and may worsen sleep, anxiety, or executive functioning over time, creating a harmful feedback loop. When explaining this to someone who doesn't understand, center lived experience. Describe sensory overwhelm, masking, and lack of supports. Avoid moralizing language, use concrete examples, and compare it to common coping behaviors like needing coffee to get through a rough morning. Practical supports help: neurodiversity affirming therapy, sensory tools, accessible routines, medication where appropriate, and peer support. Advocacy for better tailored services also reduces reliance on risky coping. If you care about someone who self-medicates, listen without judgment, ask what helps them feel safe, share accessible resources, and encourage neurodiversity affirming care. Small, compassionate steps can make a big difference.